The only clinic that was providing abortions in Missouri has been forced to stop doing so in the wake of Friday's ruling. Missouri is just one of 13 states with so-called trigger laws, which were designed to go into effect once the Supreme Court overturned Roe v. Wade. Abortion is illegal there now, and the only exception is the case of a medical emergency. I want to bring in Yamelsie Rodriguez. She is the president and CEO of Planned Parenthood of the St. Louis region and Southwest Missouri. Yamelsie, thank you for being here. So the Planned Parenthood clinic in St. Louis was Missouri's last abortion clinic. Tell us what you are hearing from patients who were scheduled for the procedure and now can't get it in Missouri anymore. How far do they have to travel?
Well, thank you for having me this morning. And luckily for most Missourians, we do have an alternative, and not to undermine that they will still have to travel a significant number of miles. But as soon as the decision came down, we knew that Attorney General Eric Smith was poised to implement the trigger ban. So by 9/22 on Friday, abortion had become illegal in the state of Illinois. We immediately ceased operations at the last abortion clinic in Missouri and worked to ensure that those patients that are in the state of Missouri who needed access to abortion services were able to get those services at our health center in Fairview Heights, Illinois, that it's almost or less than 13 miles from the last abortion clinic in the area of St. Louis.
So let me point you to a tweet from Missouri Congresswoman Cori Bush. She says, we need federally funded travel, childcare, and lodging assistance. We need to leverage federal land for abortion care services. We need to declare this crisis as what it is, a public health emergency. What kind of conversations are you having with her and other lawmakers about potentially doing this?
Actually, I was with Congresswoman Bush and U.S. Secretary of Health and Human Services, Javier Becerra, at the last abortion clinic in the state of Missouri. We were having a round table that day with Planned Parenthood and other abortion providers and advocates in the state, having conversations about the impending health crisis that was going to come upon us and what all of us as advocates and elected officials could do to ensure that pregnant people were still going to have an option to get abortion care. So yes, we absolutely support and encourage elected officials to take action, and especially the Biden administration, to call this what it is. It's a public health emergency, and he should absolutely declare one in order to be able to release the funding that it's going to be necessary for abortion providers in states where abortion is legal to increase capacity, and most importantly, to ensure that patients who are going to have to be traveling due to, racist and discriminatory policies and the overturn of Roe can have financial assistance and support in the form of transportation, accommodations, childcare, to seek the care that they need and that now has been taken away from them.
Yamelsie, I was actually in Wisconsin with the head of Planned Parenthood interviewing her Friday morning, your counterpart, and I know that there's a mad scramble in states in which immediately abortion became illegal. In your state of Missouri, legislation was filed on Friday calling for money from the president's American Rescue Plan to be used to help people get abortions. But in a similar state, Republicans control both chambers there in Missouri. So does this bill actually have any chance of passing and becoming law?
I think that at this moment, this is an all hands on deck moment. This is the time to be bold, to be innovative, and to take risks. And I am grateful at the Board of Aldermen in the St. Louis city who have put forward a bill asking for municipal funding under, as you said, the American Rescue Plan Act to support access to abortion in the form of transportation, logistical support, and accommodations. And use $1 million of that funding for that, and over $500,000 to ensure that there's going to be an equity fund for Missourians, and specifically people from St. Louis who are going to have to be traveling out of state to get abortion services. And that it's one of the many ways where we, at this point in time, need to be thinking creatively about how can we support the, hundreds, and it's not hundreds, right? We're talking about 36 million women of reproductive age who are going to be having to flee their home state to access abortion. So this is an all hands on deck moment, and we urge city officials, state officials, and the federal government to do everything in their power to ensure that while we work on the long-term strategy to rebuild not just access to abortion, but equitable access to abortion care, we have a plan to ensure that nobody's left behind and that every woman in this country who deserves and needs abortion care can get to one of those health centers around the country where abortion is still legal.
Yamelsie, let me ask you about, obviously the polling shows that the majority of Americans did not want to see this repealed, Roe versus Wade. But presumably you have family members, you have perhaps people that you know in your circle that are in favor of the Supreme Court ruling. What kind of conversations are you having with them? What are they telling you?
We know that, that overturning Roe, it's deeply unpopular. It's unpopular between Democrats, Republicans, religious and non-religious. And the reality is that most people don't necessarily think about abortion until they need one. That it's part of why, at this point, we should be having conversations with friends and families to ensure that while you may not agree with having an abortion, you are not on anybody else's shoes. This should continue. This is a personal decision. Everyone should have access to bodily autonomy. And in this point, we should also be thinking about what other potential liberties and freedoms that we have fought so hard for over the last 50 years could be on the chopping block. So this is the time to help us shatter abortion stigma, be loud, get engaged, support abortion providers on the ground, support abortion funds and practical support organizations, because this is no way to live in a democracy, and we all have a role to play.
And Yamelsie, I know we got to wrap this up, but you just said something that made me think of the fact that there are people who will need assistance once this goes into effect. In many places it already has. Where should people go? Because I know I've seen a lot of people on social media offering to help people, but that's sort of risky if you don't know what you're doing and how to navigate this very tricky legal situation. So what should people do who need assistance going forward?
Absolutely. We want, first and foremost, people to know that Planned Parenthood doors are open, independent providers on the ground where abortion remain legal, their doors are open. You can go to abortionfinder.org, and that website will connect you with the closest abortion health center in your state, and it would also connect you to the support that you will need in order to make it to your appointment. If you are thinking about coming to or in need of coming to the state of Illinois, you can call the Planned Parenthood of the St. Louis region in Southwest Missouri Health Center. We have a regional logistics center where we will not only help you schedule an appointment, but we will arrange the transportation, the accommodations, the lodging, and connect you with any other practical support organization that you may need in order to access the care that you deserve with dignity and respect.
Yamelsie Rodriguez, thank you very much. We appreciate it.
Thank you.